Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back, everybody, to Healthy Living. Jason Salas here. Dr. Jitka Lom from ExpressCare over there. Doc, great to see you and Happy New Year.
Nice to see you. Happy New Year.
Happy belated New Year.
That's right.
It's been a while since you and I have talked and sat down on this very set, worked together and everything, but we have a very serious topic. They're all serious, but tonight we're actually talking about hip problems. And I know a lot of people are familiar with problems related to the hip and specific to that area, probably like hip replacement and athletic injuries and everything like that. How prone is the hip to just breaking down, for lack of a better term, over time, with wear and tear in the body?
Yeah, it's true. Well, the hip is really the largest joint that we have. It's a ball and socket joint, and it's protected by a lot of muscle all the way around it. But then it's exposed to a lot of, as you said, abuse, wear and tear through walking, injuries as far as from football or rugby, these type of injuries, falling down. And it's a critical joint because it's used it's sort of like a hinge in keeping us upright. That's what the function of the hip joint is, and walking, taking us upstairs and so on. So it's one that often will get injured.
Now I'm thinking, because of its ball and socket nature, what keeps it lubricated, like a traditional, an engineering term?
Yeah, exactly. So we have something in all joints, but also in the hip joint, called synovial fluid. The cartilage that lines the joint actually produces this fluid, which is like a lube. It's if you touch it, it's kind of like a jelly, kind of like a gooey, not really sticky, but like a jelly, and that allows everything to move very smoothly in the hip. As time goes along, as we get older, if there's any arthritis in the hip, that cartilage breaks down. Now there isn't as much synovial fluid in there, and what can happen is there's basically grinding then of the two bones upon each other, and then there's a lot of pain.
Well, does sleep, or the way you sleep, can that contribute to discomfort in the hip?
Well, when we're sleeping on one side, we're putting pressure on one hip and then shifting the hip joint and so on. So many people.
So that's on the hip and not the back?
Yeah, both. Okay. But people will have actually hip pain at nighttime if it's very severe. Usually it's a loaded joint, meaning that when we walk, we put weight on that joint, and then it's more painful. So typically hip pain will not be very bad when you're sitting, but will be very bad when you're getting up out of your chair, very painful.
Like a load bearing.
Yeah, load bearing, and also going upstairs. But people will experience shoulder and hip pain when they're sleeping.
You're a doctor and an engineer.
Okay,
really. Well, I wanted to ask you something, Doc, because I'm familiar with, from my music days and everything, with the guitarist Eddie Van Halen, a legend, but he had hip replacement surgery late in his career, and he actually said it wasn't because he was standing on stage for all those years jamming and the position he was at. He actually said it's because of his severe alcohol abuse for decades and everything. Is there a correlation between how much alcohol you drink over time and the hip breaking down?
Well, actually, there's a correlation of alcohol and thinning of the bones. So one of the risk factors for osteoporosis is alcoholism. So, that often will go with a poor diet too. So typically what will happen is the bones will become quite thin, and then they're more easily broken.
Oh, that's scary.
Especially a fall. And that's one of the leading causes of death in elderly people, is actually fall down, break the hip, then require surgery, get pneumonia in the hospital, and pass away.
Oh.
Yeah.
Well, hopefully nobody has to go through that. Okay, well, what is hip impingement? I've heard of that, but not really familiar with it.
Okay, so we do have muscles around the hip joint that hold it steady in there. And what can happen is that we can have some actual pinched nerves traveling through there, tightness of muscles, and basically a pain that comes and goes. It might not be there all the time. Like with arthritis, that pain will generally be there all the time. With hip impingement, it's something that will come and go depending on the activity that the person's involved with.
Is there any way to maybe offset that with, or
physical therapy will help that a lot.
Okay.
If you have bad arthritis, physical therapy usually won't do a whole lot for you. It may do a little bit for strengthening and so on, but if it's a muscular problem like with hip impingement, then it will help.
Okay, so we've already covered, like an osteoporosis causing by bones getting brittle.
Yeah.
So don't drink alcohol. Try and exercise and everything to strengthen that over time. Is there anything that we can do behaviorally or even dietarily to hopefully make our hips, because this is something everybody faces as they get older, right?
It's very, very common, and it's a great question. How do you strengthen your hip joint? So the things that help are exercises that help your gluteus muscles. Those are your big muscles of your buttock and of the side here on your hip joint. And you can do leg lifts. That's really very helpful. Stair climbing and so on. That helps strengthen that. And many people, if they have a sedentary lifestyle, they're sitting all the time, they don't really have a chance to work out their butt muscles and their hip muscles here. So try to do some of those exercises. That helps a lot. Keeping your weight down is also super important for hip problems. Of course, gaining weight means more weight on your hips.
Now that's remarkable because, like when we learn in phys ed classes and, like from physicians like yourself and your colleagues, when we're taught to do like leg lifts and everything, it's normally all about the muscles and about, improving circulation and everything like that. But rarely, if ever, is it actually taught that, this actually helps your ball and socket joints or, like this helps your hip.
Yeah, well, when you have powerful muscles, then the bones don't have to necessarily be grinding on each other. There's more power there, so you're going to do better.
Okay, and for the people who unfortunately have to go through hip replacement surgery, are there any alternatives to that? Because it's a dreadful procedure from what I understand, and the recovery is extensive, right?
Well, hip replacement surgery is usually reserved for people who have such severe osteoarthritis or arthritis in their joint that they basically have an impairment in their daily quality of life. They're not able to walk. Maybe they're not able to basically do much, and they suffer a lot of pain. So that typically would be reserved for people in their 50s and up. The procedure actually isn't that bad, but the recovery is usually about a month from hip replacement surgery, and it's also quite costly. Typically, insurance companies may not cover that because it's basically oftentimes not covered, and the joint themselves will usually last somewhere between 15 and 20 years. So if you do it at age 50, you're going to have to redo it again by the time you're around 70.
Is it a steel apparatus that's put inside
It's
the body?
usually titanium.
Okay.
Yeah.
And that doesn't last throughout the rest of your life? You would think that it would.
There's still wear and tear. Yeah.
Well, titanium itself is very pliable.
I think the titanium is very strong, but then there's a coating, like a plastic type coating on that sometimes, and anything that we put in our body that we use is going to get used up.
That's absolutely fascinating.
Yeah.
Well, we do have some questions, as we always do, from our online community, so please stay tuned.
Sure.
We'll get to that, and you stay tuned because